evidence-based medicine, which a lot of the current healthcare system and the medical providers of our current healthcare system like to push, to try to validate or invalidate um, things like natural resources or natural medicines, or their mode of treatment, like prescription drugs, for example, or those things that are FDA approved versus those are not. And I'm telling you that there are different methods of evidence based. It doesn't always have to be done through a direct clinical or formal research with the data, even though it does help when you're able to gather those numbers, because it does help to solidify what the different types of treatments are doing and how effective they are. But there is no, in my opinion, there is no better evidence than someone who actually feels better in their body. They are living with more vivaciously. They have more vitality. They feel better. Their symptoms and the condition has resolved. It is no longer a concern. And so that is also a type of evidence based healthcare, when someone takes the um, initiative to apply those preventive type methods. And to be honest with you, things like high blood pressure and diabetes, high cholesterol are considered degenerative diseases that all are, the foundation of those diseases are dietary and lifestyle. And so if you can address what you eat on a day-to-day basis and how you move your body, then you can help to resolve a lot of these conditions. And so the issue with all of these additives and preservatives and chemicals and hormones in our foods, not just in meats, as I mentioned before, but in our complete food source in some way or another, those things are also contributing to high cancer levels and cysts and fibroids and, all of these internal growths that are, whether they're benign or cancerous, it's just not helpful, and it can be prevented. And so I just wanted to speak to that. So that's the whole my thought about the evidence base, and if to solidify the idea of evidence based in it being, or being available in different forms other than what we know it to be as the standard research in our current healthcare system or science and medicine. There is no true evidence based proof or indication of people who come, for example, we in naturopathic medicine, we call it the shoebox syndrome, where you have an individual on several different types of medications, Lipitor, amlodipine, you know, all of these metformin, all of these different types of meds, but there's no true evidence base, or not a significant amount of it anyway, of all of these different combinations of medications. And a lot of times that was just an example, right? But there are people who I've seen who have been on 10 different medications. They're not getting better. So, what are we talking about here? It's just, it's just time for us to re-educate ourselves, to discipline ourselves, and relearn our eating, how to eat, and what choices to make, and breaking some of these habits, a lot that are generational. And if just as you as an individual, if you're 30 or 40, 50 years old, and you're not on a path to of eating well and making healthy choices, you're talking about all of those years of reversing a habit. And it, like, again, like I said, it's not easy, but it definitely can be done.